Welcome to Surgical X, Surgery Explained. Today's topic is simple interrupted, simple running, horizontal mattress, and vertical mattress suture. We're going to use a nylon. These are all going to be superficial. They're going to be easy to do. We're really going to focus more on some tips and tricks to help your sutures look amazing. My name is Paul. I'm a certified surgical first assistant. Special thank you to all you new subscribers, and special thank you to some old subscribers, Elton in particular in Chicago. Thank you so much. I appreciate it. Let's get started. Now, you're usually going to hear that you should load your needle at a 30-degree angle, and that's fine. That's great. That's great if you're practicing on one of these and you're in an optimal position. But realistically, in the operating room, you're often not in an optimal position. So what I want you to think about when you're loading your needle is your body position. I want you to visualize the path of the needle, and then I want you to connect. I want you to connect the needle to the driver. All right? So my body position, my good body position would be kind of arms in, right? Not glued to my side necessarily, but close to my body. Certainly not out in front of me, way out here, where I'm rotating and turning my arm away from me. You want your instrument forward. What do I mean by that? I mean, put your instrument in front of your hand, like this. Now, it's really helpful for everyone else who's helping you to see what you're doing, because your instrument is forward, as opposed to hands forward, where you're turning your hand upside down. Now no one else can see what you're doing except for you. So it's very hard to assist someone who is hands forward in the operating room. So once I've figured what my body position should be, and then I visualize the path of the needle, and then I put the needle onto the driver, and that'll determine my angle. I know you can't see this, but I know you can imagine it. So position yourself, visualize the path of the needle, and then put those two things together. And that'll help you determine how to load your needle. And that's where you have to start. Load the needle on the needle driver. Simple interrupted suture. As the name implies, it's pretty simple. I'm going to use this 2.0 nylon provided by Ethicon for the demonstration. It's a pretty common type suture. Let's get our focus on here, as Eric in Indiana is a big fan of focus. All right. I've loaded the needle onto the driver. This is that 30 degrees that you'll often hear people talk about, but really, that's not the path that my needle wants to travel. I want my needle to travel in this direction. That's what I visualize. So, if my body position is here, this is where I want my hand to be. If I position, I visualize the path of the needle. Now I connect the two together. That's where it goes. Another mistake I see students often do is they come in too shallow like this. I want the tip of that needle pointed into the tissue. So that would be in this position. Okay. Back down here, my hands, they're not in the rings. I'm holding the shaft up here. So I'm going to plunge down. I'm about, 5 millimeters back from the edge. Now I'm going to let the curve of the needle do the work. I'm just twisting my hand. That arc of the needle is doing the work. Once my driver is to the surface of the tissue, I'm going to switch over. I'm not going to grab the tip, because I'm going to dull the tip if you grab it by the tip. And now I'm going to continue to rotate and pull it through. Right? Right. Now I could do that simple interrupted stitch, which is starting with the surgeon knot, which means wrap it around twice, pull that leg to the other side, and I'm just bringing the edges of the tissue together. I'm approximating, I'm not strangulating that tissue. Otherwise you'll kill the tissue. If you tie it too tight, you just want to tie it tight enough. I'm going to go back and forth. 3, 4. We'll do 5 because this nylon has a lot of memory to it. That means it's going to want to unknot itself. So I put 5 throws in there. Up next, the simple running. As the name implies, it's pretty simple. What we're going to do is we're going to start with a simple interrupted, but we're only going to cut one leg. So again, I'm going to make sure my needle is pointed down into the tissue, not upwards like that. Point it down. I'm going to rotate my hand. That's a pretty wide bite right there. I'm going to pull it through, and I'm going to tie a simple interrupted. But I'm only going to cut this leg, all right? Really, it was pretty short already. I don't think we needed to cut that. But now, I'm going to start over here. I'm going to come across. Pretty easy stuff here. Start on this side. I'm going to angle to my next spot. There's that one. What I want to do is I want what's seen on the surface to go straight across. So I'm going to go straight across from this point to here. A little deep, and I'm going to angle through. Now, I'm not really getting across to where I need to go, so what I could do is I could come up short into the wound. And then start again here. You'll notice what I'm doing as I come up. I'm advancing the needle till my next grab point is exposed. And I can grab it there sometimes. And I've loaded my needle, and I'm not using a secondary means of positioning the needle. By that I mean I'm not using a pickup. I'm using the tissue as a pickup, basically. The tissue's holding it for me. I can come up and do another. Till we get to the end. Now I have a loop here. I could pull tension on these to where they need to be. And I could use this loop as a leg and tie it down. There it is, running, simple running suture. Up next, how about a mattress? How about a horizontal mattress? Let's do one of those right here. I'm going to come in, go straight across. Let's use a pickup. Keep my fingers out of there. And then I'm going to go back. Okay. Again, just pulling the tissue together as close as it needs to be, no closer. And that is a vertical mattress. Excuse me, horizontal mattress. Next is the vertical mattress. In fact, I need a new suture. Let's see if we can get one in here. Let's see if we can get one in. So what you're going to hear is far to near, far to near, or near to far. There's a few different ways you can do this. Let's go with far away from the incision to near. And then we're going to go another far to near. And we're going to tie that down. Notice I've got a hold of the needle while I do this. You gotta be careful not to poke yourself. Keep in mind you're gonna have gloves on and they don't always fit perfectly on your hands. So you need to be careful. Okay, that is a vertical mattress suture. There's another way to do it. Let me grab another suture and I'll be right back. All right, I found another suture. This time when I do the vertical mattress, I'm going to go from far to far and I'm going to finish near. As you can see, this nylon has a lot of memory. See how it remembers the form it was in when it came in the package. It was all looped around. So what I can do is I can give this some tension. And now it's straighter. It's not as curly Q as it was before. So let's go far. And since this needle won't span the whole distance to the other side, I'm going to pull it up through the center of the wound here. And then we're going to finish far again. Now, let's do our nears. Here's one near. Here's another one near on the opposite side. Now, what's the advantage of finishing near? Well, I can get that tissue approximated exactly where I want it. A little better than the far near technique. I put exactly where I want it. But either way works. What I want you to remember when you're suturing is that position, visualize the path of the needle, and connect the two together. Notice when I was suturing, I wasn't turning my hand around. Right? Even when I had to backhand some of those, I was positioning my hand, my instrument forward hand. Then I visualized the path of the needle, which wasn't 30 degrees. It was about like that. Whatever you want to call that angle. And I connected the two together. I connected the needle to the driver. That's how you load your needle. There it is. Basic suturing. Thank you for watching. Thank you for subscribing. I appreciate it. I put some links to some of the items that I've used in this video and some of the other videos down in the description if you're interested. Just keep in mind, incorrect suturing can lead to impaired healing. And it's really important to get these basics down. Okay? Thank you again. Please take care of yourself. Please take care of your patients, and please do the right thing every time.